Thank you so much. Wow, those are so many questions. I hope you will remember all of them. I've taken note of them in case we do not. I want to start with Dr. Muhuko, what you can answer from the many questions that have been asked.
Let me answer her question about personality disorders. Personality disorders, yes, they are mental illnesses and they are treatable, and they are, they are classified from the book that Dr. Mumbi has been telling us, the DSM-5. It can be able to classify those different types of personality disorders. An example is a person who is usually very paranoid, or a person who is usually likes to stay alone or has trouble relating with people. That is a disorder that they can be helped through, therapy, psychoeducation, and that they can be helped and they can be able to, be able to interact with people and, to live with people.
Thank you. Just pick another
Let
one.
me add, exactly what she asked is what causes us to use the word disorder as opposed to illness. Because we are assuming the two are different. Because the person doesn't have a diagnosis, it doesn't say the person is okay. They are not diagnosed, so we cannot say they have an illness. Because we have to identify that illness, isn't it? But then, that person who is committing suicide, because she's asking, can the person commit suicide even if they don't have an illness? They already have a disorder in the mind. They are thinking contrary to the order of thoughts. So that's why we talk about disorders. So I say definitively that you cannot have a suicide without a disorder. There is already some disorder in the mind. There is already some disorder. I hope we understand that. And that's why then when we talk about personality disorders and all those things, they are really just disorders. So if you learn to replace illness with a disorder, you will go far. But so that I let the others answer, let me go to the person who was talking about drug resistance. We have some drug resistant conditions, and that's a reality. And psychiatrists and mental health workers know what to do. Indeed, there is that intervention, ECT, that is done, but just like any other medical intervention. Even when you are going for CS, ladies, we are told to sign a form. If you are not looking, your husband is the one who pens there. Because everything, even the Panadol you take, has a side effect. But the choice of intervention is based on the benefit vis-a-vis not doing it. So yes, there are some effects, but usually they are short-term effects. You might wake up with a headache. By the way, it's done when you are asleep. So you have no clue what's happening to you. Mama Pastor has been through it a couple of times. Does she look like she has had very many negative effects? You will have short-term effects, you may have others, but it is just like any other medical procedure. The fear also comes from just the lack of understanding and stigmatization.
Child trauma, Dr. Paris, can it cause mental illness, and how do you deal with that?
Yes, and not just child trauma. Any traumatic life event can actually lead to mental illness if not handled well. So the main thing is these events will come. Divorce among parents, the children are caught in between, loss of a loved one. If this child or if this person is not handled well, supported well during that active period, there is a high chance that later on in life they will go through the same motions, and as they are going through them, if they are not able to handle them or if they overwhelm them, then yes, it leads to now these mental disorders. The other thing we need to realize is mental disorders span anywhere from mood disorders to what we call madness. Even the personality disorders are part of them. So you might actually find these mood disorders being the predominant ones in these people who have gone through traumatic events. Like now, depression, they are overly depressed. Anxiety, those are common conditions that occur. While we are at that, there is the question that was asked about ADHD. This is a condition that a child can actually be born with, and because of that hyperactivity and attention deficit, many people do not understand what ADHD itself is. But it is a whole spectrum from very mild to very severe. Now, for us to manage this ADHD, we first need to classify. First, we have to diagnose that it is the one, and then we have to classify. Is it mild? Is it moderate? Is it severe? How do we manage? It is individualized. How long shall we be on treatment? It is individualized. We can't blanket it. And that most of the time is long-term treatment, and we usually start from about 6 months on there. Many times by the time a child is 12, 13, many of them have gone off, but then there are those ones who now are on the severe one who might actually continue with treatment even into their adulthood. Yeah.
Thank you so much, Dr.
There is a question that has not been answered.
Yeah.
Someone who is sick and they have refused to take medication. And they have
Denial.
refused,
Denial, yeah.
I don't know.
That's the issue of denial. So that's asking to you, Dr. Farida, this issue of denial, that you're sick, you don't want to take your medicine, you really feel like you are really denying. You got the question.
Yes, there are some patients who deny that they're mentally unwell, and they will refuse taking the drugs. So I will also bring the aspect of the mental illness being like any other illness. People deny even after they have been diagnosed with diabetes. They say, I can't be diabetic. I cannot be hypertensive. And they will stop and refuse. Actually, they will refuse to commence on drugs. They will refuse to adhere to the doctor's commands or orders. They will actually refuse that. They will say, this is not me. So it's also true with mental health or mental disorders. They will refuse. They will deny and say, this is not, I cannot be, actually, because of even the stigma that has been, placed on mental illness. Mimi ni mgonjwa, mwenda wazimu, that's how we call them, mwenda wazimu. So they will refuse to take drugs because of the stigma that we have placed on looking at the illness and not the person. So such a person needs to be taken through counseling so that they may be able to come out of the denial. Denial is part of us. It's part of the grief process where you start by denying first. It's a whole 5 level of emotions or feelings all the way to acceptance. First you'll deny, and then you'll get angry about it. You'll have God anger, you'll have self anger, you'll have, if, let's say for example, if somebody has been alcoholic, they'll feel angry because they'll say, I have gotten into depression because I took alcohol or I indulged too much, you see? But we started by saying that it's a disease like any other. So they'll get into anger, they will get into depression before they come to acceptance. So we need to walk them through the grief process, the grief stages for them to accept. So such a person who is denying needs to be taken through supportive therapy.
Before you even interject, Dr. Farida, the issue of denial, there seems to be a thin line between denial and faith, because I know she's talking about integration. But sometimes if you go to church and you're prayed for, let me just put it blanket statement like that, you've been prayed for and you believe that you are healed. Would you call that denial? Or maybe Bishop, you answer that before she
Exactly.
has
I thought there are people who are well versed for that.
Bishop. Like, I've been prayed for. I am well. Why should I go back to my medicine?
I think if we go that direction, I think it's also good to, faith has a work. So if you are saying you are healed, it's like what Jesus was saying, after even healing the people who had leprosy, and then he was telling them, go show yourself to the priest for them to certify you are ready, and then give a sacrifice. So it's important we know that God heals, but it's also good for us to verify, so that if healing has not taken place, God can also use medication to bring healing. So we are not limiting ourselves to only faith. Faith works. If it does not work, God also used medication, because he's the one who has given that knowledge to be able to take care of. So basically, if you are saying you are healed, also we need also to verify that. Even if the results, what are the results? Is it verifiable? Is it okay? Yeah, instead of refusing to take medication, because it's not a sign of faith. No, it's a faith even to go for testing to verify whether you are totally healed.
Okay.
Let me interject a bit before Dr. Mombi comes in and share my personal experience about faith and about refusal to take medication. Being a pastor and a pastor's wife, after some time, I felt like I needed to practice faith. Just to be, I read the Bible, I could hear testimonies of people who are getting healed. So I would go like to mountains to pray. I would go to Catoloni and pray. And when I come back from Catoloni, I come and flash my medication. And I start confessing, sasa mimi nimepona. Natoa ushuhuda, nimefanya nini? Nimepona. But after 2 weeks, and I'm doing this even without my husband's knowledge. After 2 weeks, I go down. I'm taken back to the ward. And it becomes even worse. But the moment I got to a place where I accepted that this is a problem that I have to deal with, and I'm not like, because, and this was happening mostly because of what Dr. Mudu was saying about the church. Like ukona demons, ama ukona mapepo, the stigma. That one would take me to pray and fast for so many days so that I am delivering myself from demons. Ninataka kujiodolea mapepo. So from there, I would come and then throw away my drugs. Najiambia mapepo imeisha. But after some time, I don't know what would happen to mapepo. Then they would come back. Then I'll be back to the hospital. So that is one way. It is very important. If you are working with someone, and it is true you are praying and you're doing everything and they are not getting any better, just encourage them to take drugs. One time I asked my doctor, for how long am I going to take this medication? And he answered me, as long as the Lord wants. Because he has the power to heal you instantly, and he has the power to heal you long term, and he also has the power to get you to a place where you get home, you are not healed, but you still go to heaven. The grace is sufficient. Now, coming back to the second, it was about what? About the person who is sick, and sometimes they don't know. Tuna watu wengi sana wagonjwa katika jamii zetu na hawajui, but we can tell ourselves, huyu mtu ako na shida. In that case, it becomes very, very hard. Kwa sababu, sasa hujui ufanye nini. But I believe with prayer, God can get us to that place. But if worst comes to the worst, and someone is becoming unmanageable, or you're suspecting they could be suicidal, you're suspecting that things are not going the right way, I would want to share my personal experience. Last year but one, my sister came from the US and she was very sick. As Dr. Mobi was saying, depression runs in my family, like it's genetic. So when she came, we realized that she was very sick, but she was in denial. So everybody in the family kept calling me and telling me, our sister is sick, do something about it. But now when I talk to her, she tells me I'm not sick, I'm okay. So at some point, I realized we are going to lose her. So what I did, I organized with my doctor, and we tricked her. We took her to the hospital. That is what they do. And she was admitted, she was put on medication, and today she really thanks me. She tells me, if you didn't take that action then, I would not be alive. And I thank God kwa sababu ulinifanya nijue niko mgonjwa. Right now she's a happy woman, but if we never intervened, we would have lost her. So if that case comes to that level, ni vizuri sana kushikana kama jamii, you do something about it, msimuangalia akienda kwa shimo.
Number one, if they are putting people's lives in danger, you know, they can kill, they can do funny things. We know what our patients are capable of doing. It is important to intervene. Now, how to intervene is the tricky bit. And so because every case is different, the number one thing we always say, those who see the problem, if you don't know how to intervene, come to us. One of our strengths is what we call psychosocial, we do psychosocial education. Come to us, share with us. Come now, you are not the patient, but come on behalf of who? Of the patient. Sit down and say, and have many who come, Mumbi mimi sio mgonjwa, lakini, and then describe that situation. Then we will be able to give you guidance on, number one, the appropriate way to intervene. Hata kama mtamtoa nyumbani, unajua mkimfunga na kamba, mumuweke kwa pickup, unajua atakuvuka. Maisha yake, si you have broken relationships. Come and ask Mombi, how can we ethically and in a godly way intervene and do what now Pastor Margaret is saying? How can we do that? Then we look at your situation and we guide you. Sometimes we have what we call domiciliary services in the hospital, like at Chiromole, I know they do have. They will even send nurses who, you will be surprised. They sit there, they talk to the patient. Unaona patient ametoka ameenda hospitali because they are trained. So don't sit with your problem. You might go and decide to do something and it turns on you like the sons of Sceva. Na utoke bila nguo. So be very careful, come for help.
Okay. My name is Emma Wairimo. On Monday, one of my friends had his niece attempt to commit suicide. Right now, as we are speaking, the boy is still in hospital. And let me say it by God's grace that as the boy attempted suicide, he did a video note and sent it to the best friend. So it is that best friend who called this person that they are living with and told her he's committing suicide, he's in the room. So when my friend walked to the room, he found the boy unconscious. He had already intoxicated himself and taken alcohol. So the boy was rushed to hospital unconscious, and the doctors have tried to flush out the toxic. Now the problem is the boy is still in hospital because when the grandmother was called, the grandmother is a pastor. So when she came, she started telling the boy, you are demon possessed. So the boy is still in hospital because the auntie cannot take her home where the grandmother is, and they do not know whether to talk to the boy because the husband of this lady is telling the lady, don't talk, let's be silent. And the woman is like, Emma, do we talk? And the grandmother is home, so there is no good environment for this boy who attempted suicide. So he's still in hospital as we are speaking.
First of all, the boy is in hospital. They are trying to detox and flush out all the toxins, and it's a critical thing that needs to happen. And so I like that that is happening. Now, there are two sets of people that need help here. Number one, we have Shosho, the grandmother, who is a pastor. Did I tell you the first problem, the people we need to help? She's one of those ones we need to help. But I want to point out that that's someone who needs some intervention. And because she's a minister, it helps to speak to your own kind. So if I was you, I'd send her to Mama Church, Mama Kanisa Hapa, because she needs help. She's not saying that, and I don't want us to misunderstand stigma. She's not telling that boy that way because she hates the boy. She's frustrated, she doesn't know what to do, and she's giving that which she has. So we will not blame her. So what we'll do is empty that cup and add something else so that when she's giving the most appropriate thing. So she does need help. But then there is someone else who needs help here. The parents. The parents or the family. Let me talk about the family. Because if there are other children in that family, don't they also need help? You know, we go and see adults even when people die and we forget the children. They are also human beings. Let the children come to me. And I also say in mental health, let them come to Christ. He will sort them out too. There is that family. I put it to you especially now that the father and mother are confused as to what to do and approach the situation. It is a high time that they themselves get help from a counseling psychologist, a psychologist, someone who can walk with them the journey to know what to do or what not to do. Because they are afraid to intervene. They don't know if they say something, it is going to cause the boy to go, Alex, to go off the cliff. And so they need help. But then not just them. If they are siblings and they are aware of what has happened, even that friend must be very shocked. They need what? Help. They all do need help. And I don't want us to ignore that. And all of them, no matter what they are doing, the number one thing I have learned in mental health, people react out of love. But ile akonayo ndio anakupa. Na kama hajui. And therefore, for you as a friend who knows now what has happened, it is now upon you, because we have educated you a little bit, I am hoping, that to go and tell them, go and see help. And whatever hospital they are in, you'll be surprised. There are medical counselors there. You will find counseling psychologists there. They can intervene. If you don't find anyone, ask Pastor Margaret where to find me. We need to help them. Because then if that environment doesn't change and you take the boy there, then there might be a complication. But let's assume Kina Paris, this medical doctors here, decide to discharge him. So do you keep him in hospital? No. Sometimes we have places you can take them for care, or to a relative, an auntie, someone they really are close to, for a while as the family system is being supported. There are so many ways to skin a cow. It just depends on the size of the cow and how you look at it.
Thank
Yeah,
you.
yeah.
Get help.
There was a time I was in such a certain situation. I had been discharged from hospital, but pastors came to see me and they prayed prayers that they made me more depressed because walianza kunitoa mapepo. So when my doctor came and realized what was happening, I was still discharged, but taken to a different place. So my husband was asked, we are still going to discharge Margaret, but take her to a place where no church member will visit, no pastor or any clergy will visit, or anyone doing any kind of prayer will visit. And let her stay there for 3 weeks. It's only you and your children who are going to see her. And that is what they did. And for those 3 weeks, I stayed somewhere where no one knew where I was. It's only them. They would come to see me. And after those 3 weeks, I was well. And by then, the environment of the church na mambo ya kukua mwenda wazimu ilikuwa tayari imetulia. So as Dr. Moby is saying, you can advise them to look for a place, even a friend's house, where this boy can get time to heal as they sort out their family issues. And then I think that it can really do help. Now I'm telling you something practical that happened to me. Thank you.
Thank you so much. Thank you so much, Reverend, and thank you for that experience. For the interest of time, I just give you 2 seconds. You give us your closing remarks, and then we call it a day. Thank you. We begin with Dr. Paris. 2 seconds, closing remark.
What I want to say is mental health is a branch of medicine that many people have not really understood. And because of that, we are having a lot of misconception. Any disorder, whether it is in the body or in the brain, in the mind, will require medication or will require management by a healthcare professional. The Lord has put us there as his hands and his feet that we might actually be able to manage these conditions as they come up.
Thank you so much. Thank you so much. Bishop Muhuko.
Mine is get information. And I think that will be very helpful about mental awareness.
Thank you so much. Dr. Muhuko.
Mine is to say that don't be that person who is going to kill their hope. These people need love. And if you don't know any way to help them, you must hear from the doctors and the panelists. Just take them to hospital and let's stop the stigma.
Thank you, Dr. Farida.
Mine is mental health ranges from stress all the way to very complicated mental health disorders, and they all have solutions. So don't die silently. If there's something that is not okay, if you feel you need help, please don't feel shy to reach out for somebody. Reach out for a friend, reach out for family, reach out to your pastor, reach out to professionals who are able to help you. God bless you.
Thank you. And Dr. Mombi?
Mine is to tell you, it is okay not to be okay. You need not feel embarrassed. It is okay not to be okay, and there is help available. God bless you.
Thank you. And we, from the panelists, we really appreciate.
There is nothing so painful or killing us than an untold story. That thing that you hide and you don't talk about it can kill you. So please talk to someone. If you are mourning, talk to someone. You know, losses are in many forms. Losses in health, losses in our family members, losses in businesses. Please don't, usikufe kwa kimwanaume, sema I'm a man. No, talk to someone. The last one is, let us love people just the way they are, without judging them and without calling them names, because stigma is real and it is very, very painful. And stigma is worse than an illness. I can tell you the stigma I've gone through as a pastor and a pastor's wife is worse than depression, because it has put me sometimes in a very bad situation. So please let us stop the stigma, as we had said, and let us support people as much as we can. And God bless you so much.
Thank you so much. Thank you so much. Thank you so much. And from me and my panelists here, it's bye-bye for now. God bless you. Amen. Amen.